We're going to get started. Councillors were a little delayed having some updates to their devices, but we do have quorum now. So if I can ask people to take their seats. Mayor McGarry can simply vote from the audience. Do we have any declarations of pecuniary interest under the Municipal Conflict of Interest Act? Seeing none, we have no delegations today. We're on to the consent agenda. I'm going to move up one item, 4.3, just for a comment. Are there any other requests to move any other items?
I would like to make some comment on 4.5.
4.5? Any others? Do the comments first and then approve, or the other way around? Okay, we're going to take those items out, and in the meantime, do I have a motion to approve the other items or receive them from information? Moved by Councillor Armstrong, seconded by Councillor Erb. All right, I'll make my comment on, oh, sorry, all in favor? Thanks. Just because it's in order, I'll make my comment on 4.3 first. I want to take the opportunity to clear up what I think is a little confusion around the goal that's referenced in page 3 of this report, which is to end chronic homelessness in Waterloo Region by January 2020. I did some media interviews last week about that report and about our current homelessness numbers. And in the course of the interviews, I answered some questions about whether or not our numbers are on track to meet the 2020 goal. I should have clarified then that this isn't and hasn't been an official goal of the Region's Housing Services Department or of Council. As the report indicates, the goal is a goal of Wellbeing Waterloo Region and the All-In campaign. So Wellbeing Waterloo Region is a collaborative of community individuals and groups that includes not-for-profit and for-profit and public sector organizations, and it's supported by the region. We provide the administrative support for that organization, and affordable housing is one of its 3 areas of focus. The All-In campaign is a partnership between Wellbeing Waterloo Region and the HUG, the Homelessness and Housing Umbrella Group, and it's another community initiative. So the goal of the All-In campaign is to raise funds and awareness in order to end chronic homelessness by 2020. The Region's Housing Services Department and Council haven't identified a specific goal to end chronic homelessness. However, the federal government has, and we're bound through our contractual agreements to work towards that federal goal, which is currently to cut chronic homelessness in half by 2025. So that's just a point of clarification. Thank you. And Councillor Erb.
Thank you, and thank you to staff for the report, the update on affordable housing, comprehensive information, and it really, I think, presents a snapshot of where we're at and the challenges ahead, and what's anticipated in the future. I spent some time in the last month or two talking to people involved in the work of affordable housing providers, interested public this summer. And what I learned is that everybody is doing their own little piece and doing it well, including the region, but that there doesn't seem to be maybe the coordination that would make the whole thing work a little bit better. So I think I'm looking forward to the master plan coming to council, I think in October, where perhaps we can work at that coordination with some of the providers in the region and the region. Many of the providers look to the region, understand the region as the provider of affordable care and the delivery of that service, and look to it for some leadership. And I hope that's something that will come out of the master plan. In the report, I think when the numbers have gone from 3,000 to over 4,000 on the waiting list, and at one point it was referenced that it's a 7.5-year wait for people who are single to get on the list. I hope in the master plan we begin to do some really creative thinking and thinking outside the box of what we've been doing in the past, because going from 3,000 to 4,000, obviously we're not meeting the targets or the needs in the community. And so I hope I hope there's opportunity with that, with the master plan and some other goals that we may have to bring that number down. One of the things that's impressed me in my short time in regional council, and I can take absolutely no credit for, is the grit and the determination that it took over 10 or 15 years to make the LRT happen. And it was a commitment from the community, it was a commitment of resources from the region. And I hope we can create that same kind of grit and determination for affordable housing, and come up with a strategy that over the next 10 or 15 years, we're going to do something that's going to make a substantial difference in lowering those numbers. There's no question there's political will for it around this horseshoe. There's support for it in the community, and I think we can really work at making that happen. In the report, it's referenced that there's a planned summit, I think, for the spring of 2020. And I hope in planning that summit, we can use some of that creativity in thinking of how we may want to advance the affordable housing file. Because my sense is that if we can't do it in Waterloo region, nobody's going to be able to do it. So let's take this bone in our mouth and shake it like a dog would and really try and make a difference. Thank you.
Thank you. I'm wondering whether, Mr. Bartholomew Saunders, did you want to add anything to that? No expectation.
Thank you. Through you, Madam Chair. Only to say that I think Councillor Erb has articulated a number of things that are certainly on the front burner that we're looking at relative to that summit. Meeting with stakeholders and pulling together a couple of probably at least 2 working groups that will help us look at what are the creative and innovative ways of moving forward on the affordable portfolio, given that the frameworks that we've been given thus far are frameworks that come from the federal and provincial governments that tie us to the funding specifically that comes from them, and absent additional funding or a more innovative way of looking at how to generate interest in growing the affordable portfolio, we can't really move much further beyond what the money allows us to do. But we believe we can bring some non-traditional players to the table, folks that we haven't historically worked with, and look at whether or not there's something that we can do collectively and collaboratively to move forward. And just one small clarification, and that's to distinguish between the master plan and the 10-year housing and homelessness plan. The master plan is the plan that speaks directly to our directly operated housing service, and the 10-year housing and homelessness plan is the long-term plan that speaks to being able to meet the needs of the community that would otherwise find housing unaffordable. One is to deal with our own products, one is to deal with the community at large. So both of those plans will have elements in them that will speak to this issue. Thank you, Madam Chair.
Thank you. Oh, there's a few questions. Councillor Shantz.
Thank you. Thank you. Through you, Chair. I'm not sure if there's really a question in my comments here, but as I was reading through a number of the reports, it struck me that we do a lot of determination of need and assessing, you know, what the level of need is for different levels of income or whatever. And I wonder if there's some way to pull that all together in one place, or if that would, I don't know, go against privacy issues, or, you know, can we streamline that whole process in any way?
Through you, Madam Chair. That cuts across the entire department, because every division within the department has an eligibility criterion attached to it. One of the, so the short answer to that is yes, there are some ways that we can streamline it, and in housing, children's services, and Ontario Works, or employment and income support, we are working on an integration process where eligibility will be done at the front end once. Now, it doesn't change the fact that we have 3 different databases that we have to enter everything into, and it doesn't change the fact that the process of eligibility or the eligibility determination is different from one division to the next, but we are streamlining it so that it's a one-stop exercise. Where we can't do that is within long-term care. That piece has to be held separately because the process is through, it's through the LIN that is technically non-existent, but the process is still there. So we are looking at that. We're doing our best to streamline and integrate as many of the services as we can to make it a one-stop shop. And you'll hear more about that over the coming weeks. I believe that it is October or November that we'll go live with our fully integrated front service counters.
Councillor Urbanovich?
Thank you very much, and I too want to thank staff for these update reports because I think they are very informative, but also extremely important in terms of not only dealing with the issue of homelessness and affordable housing in our community, but also dealing with many of the associated issues that are often associated, particularly with the homelessness component piece. And one of the things that I think we've come to recognize and appreciate is that our ability to tackle some of the other issues that we're experiencing in our urban centers is directly related to the ability to get people under a roof. If we can find housing for people, their quality of life goes up immensely. Their ability to deal with challenges that they're dealing with, whether it's looking for work, whether it's dealing with addiction issues, whether it's dealing with mental health issues, their ability to deal with those things goes up immensely. And so it's going to be extremely important that we really focus our energies on this. And I agree with Councillor Erb on that, in that, we're an innovative region. We've shown leadership on a number of fronts, and I think we can take that same approach to tackle these issues more aggressively. I know the municipal partners are there, willing and able to be part of that solution. I know in Kitchener's case, we've developed our own affordable housing task force working group that's working with regional staff and our own community members in terms of the tools that the City of Kitchener can use. I know we're doing some of that work jointly with the City of Waterloo in terms of looking at some of those components and how we can help facilitate more affordable housing. I too look forward to the plan coming forward, because I think that is going to be key into unlocking our ability to access more federal dollars. To be honest and to be frank, I don't think we've gotten our share of federal dollars in comparison to other communities right now. But I would say a lot of that is directly related to where we've been in terms of the plan. And so if we can get that plan completed sooner rather than later, I think, notwithstanding a little complication called a federal election happening next month, which might slow things down for a while, hopefully we'll be able to access more dollars quicker in the coming months and start making some inroads on those growing numbers on the wait list.
Councillor Erb.
I neglected when I said that I had met with a number of providers during the summer to include that I had met with a number of staff as well from the region, and they're very anxious to move the needle on this as well, and there's full support there, and so we can look forward, I think, to some positive work with staff on this as well.
Thank you. Councillor Galloway.
Thank you, Madam Chair. I wanted to applaud Councillor Zerb's interest in this area and his leadership that he's providing, and also mention that, as I have mentioned to him, that as we complete our strategic plan for this term of office, this needs to be embedded at a very high level with, some of those specifics associated to it, because that's where staff really get their marching orders from, is the strategic plan, and so that's we're going to be completing that in the next while. I did send you all an email on Sunday evening on the climate action initiative as well. So it's the strategic plan that we need to make sure this stuff gets into, and then what follows from that, of course, is staff's direction and funding and all and everything else that's required.
Thank you. I have no other questions. Just further to Councillor Urbanovich's statement, I have observed myself that this term there's a new sense of urgency from the municipal councillors. I didn't used to get a lot of emails from municipal councillors on homelessness issues, other than just how do we move somebody out of this park. But there's a number of municipal councillors that I'm now having regular contact with, because they really do want to get some work done on this issue and want to work together. And so this summit will provide an opportunity to I think, for us to educate each other on what different tools we can bring. Thank you. All right, those two items were simply information items, so we can proceed to the regular agenda. And we have a presentation, an update to Paramedic Services Master Plan.
Chief Van Valkenburg will present a few slides.
Through you, Madam Chair. Thank you. Good morning. I'm here to present the Paramedic Services Master Plan Review and Update, which is PSV 1908. Regular monitoring of paramedic service performance data has shown that call volumes have been trending above projections, and offload delay trends have also been increasing. An update of master plan projections and review of best practices regarding offload delay was considered appropriate at this time. The review found that Regional Council has increased the service's resourcing since 2017 in conformance with the master plan recommendations. And as a result, the Region Waterloo Paramedic Services has been able to slightly improve our response times. However, there has not been a progress in achieving the Council's approved unit utilization of 35%. The four key takeaways from the update and review are: 1, call volume growth is ahead of the 2016 master plan projections by approximately 1.5 to 2 years, mainly due to growing and aging population. 2, offload delay continues to be a significant driving factor for resource demand. 3, unit utilization continues to be high due to call volume growth and offload delay. And 4, in addition to addressing offload delay, investments in paramedic service resourcing utilizing updated master plan projections will continue to be required. We're going to briefly look at call volume growth, population demographics, and drivers of service demand. Our call volume growth, in the graph, what you're seeing here is response volumes in 2018 have increased to 55,696. And of note, there's a slight issue with the report, and it has a number of 55,550, and my apologies for that. The actual number is 55,696. So if you see that discrepancy, that's just a data issue. So in 2018, the call volume was 55,696, which is an increase of 23% over the response volume of 45,344 in 2015. And despite the markedly large increase in response volume, response times to medical emergencies over the same period have improved or decreased by 6%. This is due mainly to the additional paramedic service resourcing that the region has implemented in line with the 2016 master plan recommendations. The call volume growth from 2001 to 2013, paramedic services response volumes increased at an average rate of 4.1% per annum. From 2013 forward, the response volumes have been increasing at an average rate of 6.9%. The above graph shows the tipping point in 2014 where the call volume started to accelerate at a higher than expected rate, and it continues to this day. The 2016 master plan recommendations were based on future response volume forecasts that did not adjust for the shift that occurred in 2013. We had just begun to experience this increase to call volume when the 2016 master plan was being worked on. It was not expected at that time that call volume would continue at the accelerated rate. And this has been experienced almost identically by Halton Region as well. Growing and aging population. While the region's total population increased by 13% over the 10 years of 2006 to 2016, its seniors population over the same time frame increased by 48%. Looking out to 2031, our seniors population is forecast to increase at an annual rate averaging 3.8%, substantially outpacing the total population growth rate forecast of 1.1%. In 2006, our seniors were 10.9% of the population. In 2016, seniors were 13.6% of the total population and generated 43% of all ambulance responses. In 2031, seniors are estimated to be 19.9% of our total population. The updated response volume forecast. So what you're looking at there is the update low forecast, which is estimated to be 4.5%, and that's in the, I'm sorry, I don't have a color graph. I believe it's the green, and the red is the updated high forecast, which is estimated to be 5.9% average. We're going to look at offload delay. Offload delay incidents in Waterloo Region have increased by 130% from 4,573 incidents in 2016 to 10,540 in 2018. Time spent on offload delay increased by 275% from 2,151 hours to 8,060 hours in 2018. With regards to the unit utilization, so despite increases to paramedic service resourcing over the past several budget cycles and decreasing response times, the service annualized unit utilization continues to range at about 41 to 42% system-wide. And the likelihood that an ambulance will be available for the next call continues in the range of 58 to 59%. Two factors contributed to the unit utilization remaining unchanged and far above our 35% target. One is the significant growth in call volume, which is increasing faster than anticipated in the master plan, running about 1.5 to 2 years of growth in advance. The other is the significant increase in hospital offload delay, which adversely impacts Regional Waterloo Paramedic Services response capability. The original master plan unit utilization was calculated using ambulance, ERU, and UU rates combined. In follow-up to council request to understand the unit utilization of the emergency response units, the ERUs specifically, the updated chart separates the two responses out, as the role of the ERUs is to respond quickly to stop the response clock and provide care until an ambulance can arrive to transport the patient to the emergency department. But the ERUs cannot transport patients. The unit utilization trend line labeled staffed ambulances above, which is the red line, provides a representation of the current operating environment for staffed ambulances. Future resourcing requirements. So the 2016 master plan compared the Regional Waterloo Paramedic Services resourcing to resourcing levels of paramedic service peers, and that's to say it was Durham, Halton, Hamilton, Middlesex, London, Niagara, and Simcoe. We updated the 26 findings to provide context for the current level of resourcing. So currently, Regional Waterloo Paramedic Services operates with 20% fewer paramedics, and this is an improvement from 30% in the 2016 plan, an improvement from 20% fewer ambulances at peak staffing in 2016 to 5% fewer ambulances in 2018. And there's a 10% fewer ambulances overall, and this is a deterioration from 5% fewer ambulances overall. And just a note on that, when we talk about that last particular stat, that's just total number of ambulances in the fleet. It's not talking about staffed frontline on the road every day. These results affirm that the Region of Waterloo's implemented substantial additions to paramedic services resourcing between 2016 and 18. However, paramedic service peers have also implemented a relatively large numbers of resources, and consequently, while the gap relative to peer resourcing levels has been narrowed, Region of Waterloo paramedic services resourcing continues to lag behind. Future projected resourcing requirement. In addition to addressing offload delay, investments in paramedic service resourcing utilizing updated master plan projections will continue to be required in order to, 1, respond to a growing and aging population, separate and apart from offload delay, and to decrease the unit utilization towards the 35% target. Council could utilize a sliding scale to decrease our current utilization from 40% plus to our goal of 35 through a phased-in approach. That is, aim to decrease the unit utilization to 37.5 and then to 35. In order to achieve a 37.5 unit utilization in 2020, the updated master plan projections call for, and if you look at the chart, if you put the updated low forecast at 4.5% growth in response, at 35% it's 5, at 37.5 it's 2 ambulances, and if you use the updated high forecast at 5.9% for growth in response volumes, it's 8 for 35 and 5 ambulances for 37.5. And I would close by just reiterating the recommendation within the report that the Regional Municipality of Waterloo endorse the update to the Paramedic Services Master Plan 2019 as described in PHE PSV 19-08 dated September 10, 2019, subject to regular review of population growth, service demand, and annual budget deliberation, and that the Regional Municipality of Waterloo reaffirm the 35% utilization as the end target UU while adopting a 2020 interim unit utilization target of 37.5 as part of a phased-in approach to achieving the end target unit utilization of 35%. Thank you.
Thank you. There are a number of questions, starting with Councillor Paramedic.
Thanks a lot, and thanks for that report and update. I'm interested in some of the stats, and in particular, the 6.9% growth rate that we've seen in recent years. And you did, you talked afterwards about some of the growth in our older adult population and so on. But have we actually done a comparison that looks at that 6.9% as it relates to the growth in older adults plus the growth in population, and to really sort of understand, is one growing more than the other? And, is part of that growth happening because maybe we need to do some additional education with people in terms of, when to call in for an ambulance and when not to, versus just, there's legitimate need in the community.
Right, so through the chair, so in respect to the growth, so the population growth in and of itself is about 1.1% on average for the region as a whole. The aging population, the over 65 is growing at 3.8%, so over 3 times the rate at which the total population, so it's outpacing that, which is adding to that. In the one particular stat I showed in there, about 43% of our ambulance calls are coming from that particular group, and as that group gets bigger and bigger, that volume will drive up, and that's driving that volume. The really interesting piece is that that Halton region, which is a really almost identical comparator to us, is actually experiencing the exact same thing, and none of us can actually figure out exactly why in 2013-14 there was, in that graph you've seen, there was a slope this way, and then it sort of went off on a tangent, and it's still continuing on that tangent, and almost identical in the Halton region. So we continue to look at that as to what exactly is the cause of it, but mostly it's just total population growth, aging population that's driving that.
Okay, yeah, because it would be interesting to see, if we can help some of our stats through that process. I mean, there's no question in my mind that we need additional resources, but, there's a delta there that perhaps may, we may be able to discover other ways of dealing with it. I noticed this past week the province is doing a consultation on allowing for ambulances to drop folks off at places other than hospitals, which, is something that I know we've talked about around this horseshoe before. I presume we're engaging in that consultation, number one. But number two, do we have a sense of how that might end up benefiting us at all if from a response point of view?
Right, so through the chair, so yes, we will be engaging and answering questions and providing feedback, both from a provincial standpoint through the Ontario Association of Paramedic Chiefs, through the region of Waterloo, and also I've been asked to convene a meeting of the Southwest Group, which is a subgroup of the Ontario Association of Paramedic Chiefs, just for the Southwest region, to answer those questions. In terms of how it's going to impact, that will really be dependent on how they structure that and what are the parameters around that. Having lived through a similar type experience in Niagara where they had converted two hospitals to urgent care centers, and the ministry allowed us at the time to transport patients to those urgent care centers, but they weren't the same as a hospital. The parameters were so tight around who could actually go to those facilities. It just didn't make a huge difference in terms of us being able to transport patients there. So I think the proof will be in what the legislation says or what the regulations say regarding the legislative changes around that. And I think, it will help us. Any change to where we keep folks out of the emergency department or keep them at home or put them in a specialty clinic, that's going to help reduce our call volume, along with a lot of different initiatives such as community paramedicine, things like that. So I don't know what the end result will be as of yet.
Yeah, because I think part of what sort of connects with this is what Chair Redmond and others around here have talked about, which is the Ottawa model, and could that be part of the solution as well for us in terms of dealing with this? Mm-hmm. Okay, thank you very much.
Councillor Galloway.
Madam Chair, thanks, Chief, for the report. I'm wondering, are we able to model what response times would be, what utilization would be if we didn't have any offload delays, or variations of how much offload delay we would have, the current level down to zero? And similarly, could we model, if we had our own dispatch system, what our response times and utilization would be?
So through you, Madam Chair. So with regards, I'll answer the second question because it's easier than the first question. So the answer to the second question would be not that I'm aware of. I don't think we could model that because we might have some expectation of what we could do based on the Niagara model for that, but there's other things that they do which
I thought when we did our master plan, I was on that some time back, there were some projected time savings on response times. And I don't know if they were computer modeled or just some assumptions, human type assumptions that were made.
No, so again, through the chair, so those projections were based on, I believe, the Niagara system and model of what they actually experienced in decreasing their response times based on the starting of the MPDS system and different deployment models. So that was the closest we had to actually base that on. Mathematically, I'm not exactly sure if they could calculate that given all the other parameters around that, so offload delay, geographical distances and differences within our region. I'm not sure. It would be a question I can certainly take back. So in conjunction with the first question, I'm not sure that we can do it. I know I personally can't do it. I'm not that smart in math. I can add and subtract, but I can't do progressive and regressive analysis. But we can certainly ask to see if that can be done. We can make some assumptions that call volumes will grow at this if offloads disappeared, which sadly to say, I'm not sure that that's a reality that they'll completely disappear. I think we can reduce them, but I don't know whether we can ever get them to go away without a much bigger input from the provincial government. But we can certainly try to model it.
Well, I'm not sure I want to put staff through a lot of time and effort, but it seems to me that that might be valuable information to have when we do argue with the province about such things. Wanting our own dispatch system, trying to get rid of or reduce the amount of offload delay as much as possible, that we could show in some, scientific manner that this is what the result would be in terms of response times, what it would be in terms of utilization, and how we and they, because they fund 50%, could save some money or not incur new costs, let's say, as a likelihood. So I'll leave that with staff. I'm not sure we would be reinventing the wheel. I suspect somebody somewhere has done this, and maybe we can just see if that's been done before, and we can talk about it again.
Yeah, so just to add to that, so I mean, we certainly, in the report, you'll see that if offload delay disappeared, we said that it's eating the equivalent of 5.2. So we know from a resourcing perspective what that is. It's somewhat, we could make some hypothesis about the response times, although, again, it's really dependent on where the calls happen. So response times are somewhat historical, but could be dependent. So it's easier for us to tell us the system how much resourcing we'll save by decreasing that, and we can make some guesses on that. I'm just not sure of the mathematical formula to do that, but we can certainly ask that for sure.
Or another parameter might be how many code reds it might reduce potentially. I don't know. Again, if that can be modeled. We seem to be able to model a lot of things these days. With somebody's invented an app or a piece of software to do this. So, thank you.
Councillor Strickland.
Thank you very much, Madam Chair. Through you to Steve. I got a couple of questions. Thanks very much. First of all, on the call volume, and I know we have a public education plan in place and so on. Do we have a number that people can call? And if so, is it widely advertised for the use of an ambulance in a non-emergency situation?
So through the chair, we don't publish a non-emergency number. That would be a dispatch piece for non-emergency. So if you're talking about like Voyager, is that specifically?
Well, I'm talking about a personal situation I had on the weekend where I needed an ambulance, but it wasn't an emergency.
Oh, I see.
And there is a number on the region's website where you phone, and I haven't had a chance to talk to you. And as I was going through that search, I noticed that in other municipalities, they have this service, and they also have non-medical emergency transportation provided by like Medevac and those kinds of things. So I think that's something we need to look at, which will help with our call volume, a non-emergency. Because sometimes you need an ambulance, you don't need fire and police. So if people are defaulting to calling 911, there might be a better way that we can educate them to make a different kind of call.
So through the chair, so again, I'm not sure the the manual practice piece for the dispatch side, but whether you call 911 or the non-emerge side, they'll put you through the triage system anyway at the dispatch level. So they would say, this is or isn't an emergency, and the tiered response would be predicated on the answers to the questions that you give, because it's not just an automatic, if you dial 911, you get police, fire, and ambulance. There's a system in the back end of the dispatch system that says if it meets a certain criteria after asking these questions, then it gets a tiered response or it doesn't get a tiered response.
So as you were saying, it would make a difference because you end up with 911 anyways and tiered.
Correct.
But there just might be something in there, just anecdotally when I was going through this situation, for non-emergency transport to a hospital.
Yeah, absolutely. In terms of, and I think the bigger piece is the education of, do you need an ambulance or do you need a transport service without a medical emergency? So I think there's an education piece there to be fettered out.
I'm just thinking that we've been dealing with this for dozens of years. We just got to try different options to solve the problem.
Agreed.
Okay, and then I'm just wondering, Mr. Murray, if you can give us a brief update on the discussions you've had with various healthcare leaders on the offload delays.
Yeah, happy to, through the chair. So I've had one-on-one discussions and then group discussion with each of the hospital CEOs. So they've seen all of this data, so they recognize the trend on offload delays is going in the wrong direction. So there is commitment with all the three hospital CEOs, to engage in a joint process to look at how do we reduce offload delays. And we're going to use, I think you're all familiar with Lean Six Sigma process improvement. This is a process. It's complicated, and so they're all committed to engaging in this. We've got a terms of reference for the project. We're about to get started on it. So I think, yeah, there's really good support. They recognize it's a problem. It's a problem for the hospitals, it's a problem for us, a problem for the community.
Okay, thanks for that. So are the terms of reference available publicly?
We haven't made it public, but we haven't made it public.
So if you can check with your colleagues, this is a much import to the region and to our community, and the offload delays is not improving. We all know the story. And people who use those services and use our emergency rooms, you know, our citizens are experiencing it every day. So it's of great public interest.
Yeah, I think what we could do is, you know, maybe even as soon as, we'll find an appropriate time at a Community Services Committee meeting to do an update report on the ambulance offload delay improvement project.
Okay, that would help. Okay, great, thanks. And then the other thing, Chief, you know, there's a lot of technical information. There's a lot of different variables and charts you need to consider from a management perspective for ambulance services. And so I'm a lay person. I've been involved in this issue, but I don't know all the intricacies the same way you and your staff do. But when I look at the unit utilization and it's creeping, it's not hitting our target, it's higher than what our target is, but our response times are going down. So why should I be overly concerned if our unit utilization stays at 40% if our response times are increasing or improving rather?
Right, so through the chair, so I'm going to try to answer this question. So the thing is, the higher you get in the unit utilization, so over 40%, it's an industry benchmark and standard that anything over 40% is not sustainable for the crews and the service, because the higher you start to go over 40%, the less that ambulances are available to respond to that next 911 call that comes in. And we try to keep a certain level of ambulances available to be able to respond to that next 911 call because they're not ever staged. The reason that the response times are actually decreasing is because most of the ambulances are picking up patients and coming into the urban areas to drop off at the hospitals, and then most of the calls are happening in urban areas, so we're getting to the calls quicker because we're not having to respond from distances. So that's why our response times are actually dropping, like the 6% that you've seen in the report. So, you know, if we had a unit utilization where we could keep resources within their station, it would certainly be of assistance for that. And I see Mr. Murray would like to.
Okay, I guess maybe a little thick this morning. I'm still not quite getting it. So what, if I'm understanding what you're saying, is that it's true the response times are decreasing, the unit utilization is not as low as we'd like it to be, but basically you're saying if that trend continues, we'll see the response times start to increase again. No?
Sorry, just.
Mr. Murray would like to.
If not, then I'm wondering why we're so concerned about a 35% UU rating.
Yeah, and so maybe I could take a crack at it because I've had the same conversations with the chief. So my relatively simplistic understanding is the flip side of unit utilization is ambulance availability. So if we're at a unit utilization of 40%, what that means is we've got ambulance availability of 60%.
Right.
So I think it's actually more related to code yellows and code reds. Keeping unit utilization at a reasonable level, I think, is more likely to keep us out of code yellows and code reds. And when utilization gets too high, then ambulance availability is low, and then we're going to see code yellows, and we're going to see code reds. So
Okay,
that
helps.
And that, in and of itself, separate and apart from response time, the ambulance availability in code yellow and code red is a separate problem, but it's a problem, right, when we get into
Okay.
code reds.
All right.
So I think they're two variables. They are related, but we're trying to focus on both of them at the same time.
Okay, so that helps.
Dr. Wang has something she'd like to add.
Just quickly, so also when you look at industry best practice, it's recommended that you have a unit utilization around 35 or lower in order to ensure the sustainability of the crews running all the time. When you have a unit utilization of about 40%, that's a heavy load on the crews, continually always being at maximum capacity. So that's another reason that we want to reduce the unit utilization closer to what is considered best practice to reduce the strain on the crews running all the time.
Okay, so that's great. Now I get the importance of unit utilization, and I thank you for that. Okay, so just final question. Budget related, so I understand, we all understand how valuable paramedic services are and now the importance of unit utilization, but I'm not sure what I'm approving in terms of a cost perspective. So what is the number? I don't know the number off the top of my head of what our increased expenditures are in the master plan for 2020, and what does this increase it by?
According to the report, what we'll have to do during budget is decide whether we're going to be looking at a low forecast or a high forecast.
Yeah, I saw that.
And what I found interesting was that the high forecast of 35% overlaps the low forecast of 37.5%. So budget-wise, we may not be looking at a difference. And I'm going to defer to...
Well, that's what I'm trying to determine. Are we approving an enhancement over and above the master plan by approving this unit utilization rate today? And what is that number?
So I would say, in terms of adding resources and budget approval, you're actually not approving anything today. And we're careful to say in the report, all of this is subject to annual budget approvals.
Okay, but what's the number, Mike?
So Craig probably knows the number, and it ranges from adding 2 ambulances, which I think is consistent with the previous master plan. The previous version would have had us increasing ambulances by 2 in 2020. So that's at the low end,
right.
2. Craig can give you the number.
Okay.
And the higher end is 5. Well, the medium end is 5.
Okay.
Yeah.
Okay,
So
got
that's
it.
the range, is 2 ambulances to 5 ambulances. I don't know if Craig has off the top of his head what that would equate to. Okay.
Through you, Madam Chair. So the intent then is to bring forward a couple of different options, as Mr. Murray has indicated. The 2 ambulance option, I'll say on an annualized basis, is about the cost is about $1.6 million. On the assumption that the province is going to continue to provide funding at the 50% level, then that would be a levy impact of about $800,000 that would be spread over 2 years, 2020 and 2021. The 5 ambulance option takes us to a little bit over about, so it's about 3.8 million on the expenditure side. And again, assuming that we will continue to get funded from the province, half of that, so about 1.9 million would be the levy impact. Again, spread over 2 years, as we typically budget for these issue papers for the service to come into effect partway through the year.
So 2 is in right now at 1.6 million, and if we decide on a range from anywhere from there up to a total of 5, at 5 it'd be 3.9 million.
On
Gross, not net.
expenditure basis, yes, that's correct.
Okay, so that's what we're essentially given direction to here by endorsing this. So that would be an enhancement over our existing master plan, because then there's 2. So what this is saying, if we increase the unit utilization, we have to look between 2 and 5. Because otherwise, like, what's the point? If it's in the master plan already, then what's the point?
Well, through you, Madam Chair, regardless of what's in the master plan, as Mr. Murray indicated, we would say it's approval of the service expansion is contingent on budget approval. So I think what we can bring forward for council during the budget process is that range of potential costs. And what I just can't recall off the top of my head, if two ambulances was in the master plan originally, then that's one of the scenarios that will come forward. And then it'll be at council's discretion as to whether you want to approve in addition to that. And we'll provide council with all the necessary information and costing to help make that decision.
So we're providing additional option for improving upon the master plan to be decided at budget.
Yes, and I might also add that if you recall during the, when we had the discussion with respect to the budget report back in August, we had included in the projection a provision, if you will, for service expansions, which would have included two of the ambulances, so I guess the two ambulance version of the issue paper.
The 1.9 million. Okay, that clears things up. Thank you very much.
Councillor Shantz?
Thank you. My questions were around unit utilization and offload delays as well. I guess something that's puzzling me or bothering me a little bit, I guess, is we've seen a four-fold increase since 2016 in the hours of offload delays. And we've talked about this, I know, for a number of years. And so I guess I just want to emphasize again the importance of dealing with that. My question is, 5.2 ambulance shifts is what the offload delays represent. Would that be like 1 2/3 units? Is it 3 shifts per ambulance? Like, how does that turn back into number of units?
Right, so it's consuming 5.2 12-hour ambulances per day.
So
Okay.
I'll just quickly add, so that represents 16% of the ambulance shifts that are available per day. There's a denominator, I don't know, but if you put 5 over the denominator, it's 16%. We've done the calculation, Stephen and I have done it.
So if we reduce the offload delays back down to the 2016 level, we would be eliminating, say, 6,000 hours of offload delays. That would be equivalent to what, approximately 2 ambulances?
Yeah.
So I think we have to be careful in looking at just adding ambulances to get to our utilization levels, and I think we need to really focus. And I know I appreciate that Mr. Murray's doing that, but I think we really need to push the importance of dealing with the offload delays.
Mr. Murray?
Yes, thanks, Madam Chair. Yeah, so I absolutely, I just want to reinforce that, we've had a lot of discussion about it, and I think what we've concluded is we likely need to do both. We need to focus on offload delays. We need to reduce that. That is going to free up some existing ambulance capacity. And in addition, we probably need some ambulance additions in 2020. So it's probably a two-pronged approach. Also probably because to really start to see material improvement in offload delays is going to take a little bit of time. And we got to figure out what kinds of things we can do differently. That'll take a little bit of time. We're pretty confident that we'll find ways to reduce that hospital ambulance delay.
Do you want back on? Yes.
Just one more question. So why such an increase? Is it just volumes? Or is there something else happening in the system?
Well, certainly through the chair. So from our perspective, certainly our volumes are increasing. The data that you've seen shows the increase in the call volumes, and the population is aging, which is using up more resources than they're going to the hospital. I'm somewhat hesitant to speak on behalf of the hospitals of what their internal issues are as to why they can't do that. But there's, as we've said in past, it's a systemic issue. It's not just an emergency department issue. They can't get people off the floor out to ALC beds in the community or discharge, so therefore it backs up. So it's a very, as Mr. Murray says, it's a very complex issue, and it's going to take some time to sort of figure that out.
Councillor McGarry.
Thank you very much for the report, and I had a few comments. Some questions have been asked by my colleagues. So through you, Madam Chair, I did want to talk a little bit about the offload delays. Certainly in my time in the emergency department as a nurse over many years in many jurisdictions, offload delays are the complicated answer to trying to decrease the number of paramedics that are being held with their patients in hallways or out on the driveway of an emergency department. And if you look at the demographics coming into the emergency departments, there's a number of different things that we can do to try and decrease the number of people needing the emergency departments. In last night's town hall in our community, road safety was the #1 issue that was brought forward during conversation. And this is our 3rd or 4th town hall now, where road safety is one of the top 2 things that people talk about: speeding, accidents, near misses. And municipalities are trying to deal with this really across the province or across Canada right now. But that would be one issue where the community could take more responsibility in ensuring that when they're out on the roads, they're walking, cycling, to follow the rules of the road and try and make sure everybody's safely there. So I see that the number of people and the types of patients that are being seen in the emergency department is quite complex, quite varied. It's an aging population as well. But I think there needs to be even more public education about how we can avoid going to the emergency department in the first place. The other thing that my question for you is regarding the number of overdoses that we're seeing in the communities. And again, this is across Ontario, certainly in our community. We have seen an increased volume in the last couple of years. Do you feel that there may be fewer calls once the consumption and treatment site opens up on the temporary basis here in Kitchener?
So through the chair, we've bantered that question around. The number of overdose calls, although substantially high in the region, as we all know, it's really a relatively small portion of the calls that we actually service as the 55,696 calls that we do on a yearly basis. So even if there was I'll say 50% decrease in overdose calls, from our perspective, it's not going to affect our response times or utilizations because it's such a small number of calls for that. But I would suggest, yes, it will. I just don't know what the full impact of that reduction in serviceable calls for overdoses would be in the region as a total.
Thank you. And if I may, Madam Chair, Cambridge Memorial Hospital expansion has been delayed a couple of years now. That will show a substantial number of new beds in the emergency department once it opens. Do you anticipate a drop in offload delay at least at that facility once that new emergency department does open?
So through the chair, one would hope yes, based on if they increase the number of beds in their facility, that our offload delays would decrease. But of course, that's always dependent on call volumes and people walking into the EDs and filling up those beds before we arrive. So I can't, again, unequivocally say that it's going to help, but it should, yes.
Okay, thank you.
Councillor Nowak.
Yes, through the chair, just a quick question. You did some comparator review. I don't know what page that's on, page 8, I guess. The question I have, do you know what, now each of these organizations or communities that you did the review with would have their own unique challenges, I'm sure. But they all have extra resources compared to what we have here. Do you know what their utilization rates are? Have those extra resources brought their utilization rates down? Do you know that?
So through the chair, we did ask, and it was in the raw data, it just didn't get into the published data for that, and we can probably provide that data if you wish.
Do you have a sense that it's made a significant difference in those communities?
Well, I would suggest that they had a lower unit. If you're talking about just unit utilization rate, would that be correct? Mm-hmm. So they would have started with a lower unit utilization, probably through system design back at the time of transition or the years leading up from 2000 till now. So they do suffer from the same issues about response times and utilization. That's pretty standard across the board in the province. But I don't know off the top of my head what those numbers are, but we could certainly provide them.
Do they suffer from the offload delay issues as well? I'm assuming they probably do.
To differing degrees, they do. And one of the things that we did ask when we were doing the stakeholder engagements was to ask them about their offload delay, and actually, which has led to the Lean Six Sigma project that we're actually doing here.
Thank you.
Councillor Lorentz.
Thank you, Madam Chair. I know we've kind of beat this thing to death, but I just want to make a couple of comments and ask a couple of questions as well. I really appreciate the discussion we're having this morning because I think it's very important. This is the kind of service that people don't really think about until they need it. So to me, this is something that we need to get right. But when we talk about offload delays, I think Grand River shuttered 40 to 60 beds and the province fired nurses. I mean, no one wants to talk about that kind of stuff, but if those beds were available, I think there wouldn't be a delay. My understanding is that the province is going to have an expert advisor to deal with alternative destinations. Chief, do you know who that is or where that is at?
Through the chair, I'm not aware of that name, but there's a lot of suspense around the province to see who that expert is.
Yeah, I can imagine. So have we taken a stab at what the criteria would be for a patient that would qualify for an alternative destination?
So through the chair, one of the difficulties is putting the cart before the horse. So until they tell us what the regulation is, and if they amend the act to say that patients with these particular CTAS scores, the triage acuity scale scores, or certain preclusions that they have to go to ED, until we know some of that information, it's really hard for us to say that, can it be someone with a fractured toe just goes to an x-ray clinic, or someone that has breathing problems goes to a respirologist's office. We don't know exactly. And then based on top of that too is the fact that what are their vital signs when you get there? So are they, experiencing chest pain? Are they going to have a major heart attack, and it's just they're not presenting as normal? It's quite complicated to triage these patients, and so the paramedics are going to have to be able to do that, and within the set parameters that the ministry sets down for us.
Well, I know your association is looking at really pushing to have this, so we must have some kind of criteria that if we were asked, we would say this is, you don't have to give it to me today, but I'd be interested to know exactly, and the percentage of previous calls that we've taken to hospitals that could have been gone to alternative destinations. I think that would be really good information, because if you're not offloading, you're not being delayed. So I think that's a big crux to resolving most of these problems, is to be able to take patients that qualify to alternative destinations. So anything that we can do to help, I let us know, because in my mind, I know the minister announced this a couple of weeks ago that they were going to have an expert advisor, but I think they're taking it seriously as well. So I think there's savings to be made. I think there's efficiencies there, and I think it's going to be one of the big solutions to our problem. Thank you.
My questions have all been asked and answered. I do have a comment, though. I think we've done a really good job through this conversation of separating the issue of offload delays and what we may or may not be able to do about them, and I do appreciate the staff have some optimism. I have to observe that I don't think all of the things are the hospital's control either, so with the best intentions, I'm not as confident that we'll be able to affect a significant difference this way. That being said, I think we can talk about offload delays. We can move matters of how many ambulances we're going to need to our budget conversations. I'm not personally comfortable with changing our target to 37.5 because I think, as has been said, this isn't just an issue of code reds and code yellows. It's also an issue of staff fatigue and burnout. And I feel like 35% isn't an ambitious target. It's, as I understand it, just really a standard. And I'm really not comfortable taking our foot off the gas this way. My preference would be to proceed with the offload delay discussions, to look at how we're going to make this happen when we do our budget, but to maintain the 35% UU. That's just me. So no further questions. We do have some recommendations. Sorry. I do have some questions.
Sorry, yeah.
Councillor Evans.
Just one quick one. I'm wondering if we could get a brief update on the new building. Where's that at, and how's it going, and when is it going to be operational? Sorry, Madam Chair.
So through the chair, so good question. So we're on track. We're hoping currently, you should be seeing a save the date for yourselves coming out within the next day or so for, I believe, November 12th for the grand opening of the station, and it'll go operational on November 17th. So they're expecting substantial completion October 14th, and then they have some HVAC testing, et cetera, to do before they can actually start to move furniture, et cetera.
Councillor Redmond, were you moving the recommendation?
I was prepared to move the recommendation if it has not been moved. Yes, I have.
It has not. Is there a seconder? Councillor Armstrong, all in favor? That's passed. Thank you. You must be tired of standing. We have another staff presentation from Community Services Committee on human sex trafficking in the region of Waterloo. And are you going to be introducing this? Okay. I think Mr. Bartholomew Sanders is going to speak to this.
Thank you, Madam Chair. Through you. This is a report on, or a presentation on the sex trafficking report that was completed by the Crime Prevention Council, and I believe it's Julie Thompson who's going to speak to it.
Good morning, Chair Clark and members of the Community Services Committee. Thank you for allowing us to present to you about the Chelsea Story project. First, I would like to introduce Nikki Carswell, who is the coordinator of the Anti-Human Sex Trafficking Program of the Sexual Assault Support Center of Waterloo Region, and Sam Vardanak, who is the Executive Director of Registry Theatre. My name is Julie Thompson. I'm staff at Waterloo Region Crime Prevention Council. In response to the growing prevalence and the gross lack of awareness of human sex trafficking in our region, the Waterloo Region Crime Prevention Council forged a unique partnership with JM Drama of the Registry Theatre and with the Sexual Assault Support Centre. We secured the rights to the British play Chelsea Story, and it was adapted for a Waterloo audience. The production became a centerpiece for a series of outreach educational opportunities about human sex trafficking in Waterloo Region this past winter.
Hello. So sex trafficking, it's the use of force, fraud, coercion, manipulation. It's getting someone to commit sexual acts against their will. It is organized sexual abuse of children and others who are vulnerable for profit. And what I mean by vulnerable isn't necessarily the kids in our group homes or the kids who have addiction issues or mental health issues. It can be simple vulnerabilities such as, my boyfriend broke up with me, I have low self-esteem, my parents are getting a divorce, any kind of vulnerability, which is not fault, it's just susceptibility to harm. When we look at our region specifically, so first of all, nationally, Ontario has 70% of human sex trafficking happening. We are a densely populated province with expansive highways like the 401 and the QEWs. But for Waterloo region, we've seen a great increase. I mean, in 2015, police were reporting 27 incidences. Here it is 2019, the year's not even over, and they have 75 ongoing investigations. Myself, as the coordinator of our anti-human trafficking program at SASC, we've had over 250 calls, and we just started last January 2018. We've had, of those 250 calls, 160 of them were direct referrals, and we have directly served over 100 clients. We're only a year and a half old. Two big factors that we're seeing is gender and age. Nationally, 93% of sex trafficking is happening to young women and girls. Average age of entry into sex trade and sex trafficking is 13. That is similar to here in our region. Since Chelsea's story and getting the word out and showing what trafficking looks like, we've had a great number of increase in calls for people who are 12, 13, and 14. When we talk about what's driving this, there's a lot of different factors. I mean, it's lucrative. A trafficker can make an average of $280,000 a year per girl, and a lot of traffickers have multiple girls under their belt. Highly lucrative, easy to get away with because of the psychological manipulation and what is known as the Romeo pimp. However, access has greatly improved. So we're getting access to people in every single home, not just the homes of foster care, but every home. So whether it's through a smartphone, through the internet, Instagram, Facebook, Snapchat, or even our open world video games like Fortnite, we're seeing a lot more grooming. We're getting a lot of calls for people who aren't involved in the system, but who come from stable homes as well. Age is huge. Again, ages of 13. There's a huge demand for young folks. They're worth more money in this trade, unfortunately. For our clientele, over 50% of our clients are under the age of 18, which is right on target with what we're seeing nationally. And as I said, we're getting an outrageous number of calls recently for 13-year-olds. There's a high demand for young folks, as well as this is perpetuated by a culture that allows and normalizes the harm of women and children. But still, within our region, we're getting a lot of people who don't actually know what this is and aren't recognizing that this is happening here in Waterloo region. The increase with police and the increase with my program does prove it is happening. And Chelsea's story was an excellent method of getting that story, not just to parents or teachers or community people, but to the young folks as well.
And so that's where JM Drama and the Registry Theatre came in, because obviously what we do is tell stories, and we understand the importance of storytelling to take facts and figures and dire warnings and translate it into a meaningful, relatable human experience. We can warn young folks about what human trafficking is, but until they see what it looks like played out, they're ill-equipped to confront it and to contend with it if they ever do end up facing it. And so we had the good fortune to connect with Sean McGrath of Alter Ego Creative Solutions in the UK. And I want to mention here that I think the UK is a little further along in this, confronting this issue than we are here in Canada due to several high-profile cases that struck in the last decade or so. Their public education and outreach is much further along, whereas I think here in Ontario we're still identifying that this is a problem. So a unique community partnership was forged between JM Drama and the Registry, Sexual Assault Support Center, and the Waterloo Region Crime Prevention Council to present this play, which itself theatrically is very lightweight. You can do it with the way it tours in the UK is 4 actors in a car, and all they really need is a bit of real estate and an audience. And it's done that way on purpose in order to make this very easy and cost-effective to bring to the target audience, which is schools. grades 7 and 8 in particular are the most vulnerable populations, and when that information does the most good to get to young people. We encountered some difficulty this year getting into schools to do performances. I suspect that might have had something to do with uncertainty around the changing sexual education curriculum from the Ministry of Education for the province. I also want to mention here that this is an issue that disproportionately affects Indigenous populations, and so bringing it to those communities is also vitally important. We were not able to get into as many schools as we would have liked. We were able to go to one school in Cambridge, William G. Davis, and had an absolutely phenomenal experience there with a talk back that went on and on with students who were clearly, this information was resonating for them, and they had a million questions, and it was fantastic. But what this basically was proof of concept. JM Drama is a community theater organization. We're not a professional theater touring group. In order to do the sort of touring required for this, you would need full-time actors, where this is their full-time job. But we were able to get, people could take a day off and come and do this one show. So most of what we were doing was laying down proof of concept, introducing the notion of human trafficking to the community, and trying to build a groundswell of support for this sort of work. We viewed this as phase 1. Phase 2, we hope, will be a more robust series of performances to schools and other vulnerable Indigenous populations and otherwise in the region. But in addition to the performances, we were able to do a number of ancillary events, a film screening at the KPL of a film called Very Young Girls, which focuses on trafficking, and a panel discussion. We were able to go to the Grand Valley Institute for Women and perform the play there to get feedback from folks who had experienced human trafficking to say, how is this information resonating for you? Are we getting it right? Are there things we're doing that are going to trigger folks? Very important to make sure we're doing no harm. And we're able to attend a hospitality conference in Toronto in April of this year because, of course, hotels are a major place where this sort of activity is happening. And so if we can train staff there to see the signs, then we set ourselves up to succeed in terms of addressing this problem.
Okay, so we believe that awareness leads to prevention. This infographic shows the reach of this project. We had 3 partner agencies and 3 funders, 6 theater volunteers, 4 of them were actors, 10 passionate community engagement community members, 2 distinct events, 5 diverse venues, a library, a prison, a school, a theater, and a hotel, 9 captivating performances, and 1,135 engaged audience members. Our 3-organization partnership was able to rally 34 individuals from 23 organizations to build our capacity and extend our reach. We mobilized teachers, parents, advocates, theater people, law enforcement, Crown attorneys, students, just to name a few. All passionate about getting the word out about trafficking in our region, all determined to get this terrible issue onto our community's radar. One fun note, 16-year-old JC, our fearless stage manager, won the Kitchener Youth Action Council Award for Arts and Culture. In addition, the talkback themes and feedback forms were collated into a thematic analysis which documents the audience reaction and on the performance of the film, on the performance and the film. That's included in your package. We also produced a fact sheet or a rap sheet on human sex trafficking, which is available to the public, and developed an annual communications plan, which is designed to keep building awareness. And SASC developed a school curriculum about human sex trafficking.
Through this project, SASC put together a curriculum called Reset, Recognizing Exploitation, a syllabus to end trafficking. Currently, our politicians have a copy of this. It did hit national news this week through CBC, which is pretty cool for us. And it's currently under review by the school boards, and there'll be meetings taking place this October with our public education manager, TK, who would be here to speak more about this, but they just had a baby.
So I think our next steps are to build a professional tour of Chelsea's story to the venues that we spoke of. This would hopefully be done in collaboration with MT Space, local professional theater company. The artistic director, Pam Patel, actually volunteered to direct our production of Chelsea's Story, so that organization has already shown tremendous investment in this project, as well as implementing the reset curriculum package that Nikki spoke of, and continuing our activities. So February, there's a day in February that's Human Trafficking Awareness Day, and we're committed to doing regular programming on that day to keep the public aware of this issue, and to keep this amazing group of this committee together. It's been an amazing experience working together. We feel as though we're doing really great work, and we want to keep the ball rolling on this project.
So our response to trafficking in Canada and indeed locally is limited mostly to addressing the issue after the harm has been done through rescue, treatment, enforcement, and incarceration. Most of the focus is on victims and on preventing victimization through awareness raising and those who are with those who are vulnerable. This is really important work and it needs to continue. However, we also need to go further upstream before there are victims. We need to address the easy access to children through technology. We need to ask ourselves what turns someone into a person who can exploit and sell another human being. And above all, we need to ask ourselves, why is there a substantial demand for sex with children and others who are vulnerable in our society? This demand is a primary driver of human sex trafficking. Thanks so much for your time. We'll entertain any questions.
Thanks for your presentation, and there are lots of questions, so I can ask you to wait, starting with Councillor Foxton.
Thank you, and thank you so much for this. You know, lifetime sometimes takes you down a series of events, and Christiana, you released those documentations on the suicidal deaths of teens in our schools, and especially females. And I met with the Governor General last week and talking about women's issues and girls' issues, and there is funding for this, and I said I would try and do a program in our township. I would love to bring Chelsea's Story as my first initiative. So I hope that you'll be in contact with me so that we can make this happen, and I'm thinking before December.
I also want to mention quickly here that a full production of the play is one option, but something we found very effective and is much more lightweight and easy to do is what we call a reading. So we bring actors and they have scripts, and that way we don't have to rehearse where people are moving when, or people don't need to memorize. It's something that we can put together quite quickly, and I wanted to offer that to any group, including this one, if we'd like to organize a reading. That is something that we could put together quite quickly.
Well, whatever you can offer, because this is just the starting point. I think we have to have this dialogue ongoing. Something's happening with our youth that I'm greatly concerned about, because they are our future, they're our next generation. And they seem to be a little lost. And if we don't start to connect and try and appease this, then we're all going to be in trouble. So I hope you'll connect with me and we'll start the first phase. Thank you.
Councillor Redmond. Chair Redmond.
Thank you, Chair Clark. I had the privilege of seeing Chelsea's Story, and it was amazingly well done. And the two things that I just want to hit on is I found it a personal disappointment that you didn't get into more schools, especially at that grade level. And you've referenced that it might have been the uncertainty around the sex ed curriculum, because my question was going to be, what were the excuses, the rationale given? It was so well done, and for any of you who haven't seen it, it's absolutely worth seeing. And I know Councillor Galloway was a huge proponent as a member of the Crime Prevention Council to make sure that we saw it. Minister Bardish was at the performance of the Registry Theatre that I was at. It was incredibly professional. The question part at the end was really good. So my two questions are, was there other rationale given as to why you only got into one school? And very exciting to hear about the creation of the syllabus, and it sounds you're a bit more hopeful. What's the process to make sure that that actually gets into schools?
Do you want to talk about the syllabus first? Or do you want me to go? We're not really sure the whole reason why we had difficulty getting into the schools. There was a lot of interest from schools, but I think maybe even just the nature of talking about human sex trafficking with such a young group was something that made people feel a little like they didn't know what they were getting themselves into. We really feel like to bring it back, so to have Chelsea's Story come back, we've got a theatre production that is ready to take this on as a professional production. We have a number of funders that are already in line that have also said that they'd like to fund that production. And our next big step is to work with the schools and to address their concerns. And so one of the things that we wanted to do was to go to the school. I think there's a vice principal meeting that happens, and maybe do a reading of Chelsea's Story, because I think once people understand what the play is, they can see why it's so powerful with the kids that they work with. And do you want to talk about the syllabus?
As I said before, the syllabus is currently being reviewed by the curriculum, and until those meetings happen in October, I won't have a whole lot more information about that.
I just want to step in and say there's a big gap between theory and practice when it comes to this piece. When you tell a school administrator, we're going to bring a show about human sex trafficking to your school, I think it sets off some red flags. What's the content? How upsetting is this going to be? Is it going to be a trigger for people? But once people see the play, almost universally, we heard back from audiences, this was not inappropriate at all. I had all these conceptions about what it might be, but the subject matter is very deftly handled. It uses, as you know, it goes back and forth between students in a classroom who found the diary of Chelsea, who's it's based on a real story, a young lady who experienced sex trafficking, and then they reenact the scenes in the classrooms. So there are several, from a theatrical point of view, layers of safety woven into it to take us one step away from the subject matter, to make it a little bit more approachable. But that's what we found routinely, is that the idea about what it might look like and what it actually did look like were two different stories. So that's why we feel like we need to get this play in front of teachers, in front of vice principals, and other sort of legislators to say, this is what it actually looks like. And then they'll go, oh, okay, well, I think that's great, and young people need to see that.
I'm just another footnote. It might be interesting to have a relationship or a presentation done with parent-teacher associations too, because I think that any parent that sees that realizes you're arming your children with knowledge. It's incredibly well done, and I commend you with looking for strategies, because if you demystify how you're presenting a very controversial topic, I think you will win people over hands down.
Councillor Jaworski. Excuse me, Councillor Jaworski.
Through the chair, further to Councillor Foxton's idea, I think it would be useful to send that script concept to everybody here at Regional Council, so we all get an understanding of how that might work, if there's facilitated sessions afterwards, how that might be hosted. My question, though, is on Reset, which I think is the syllabus that you're talking about. So when I look at this program here on consent and healthy relationships and vulnerability and exploitation, has that been offered yet? Is that offered by SASC? Is that the one that's waiting for the vice principal's meeting? So this hasn't been offered as yet. It's wonderful content.
It has not been offered yet, no. This is the one, this whole package is the one that is up for review right now.
Wow.
And did get national coverage, so
Wow.
there's pressure now to review it well.
Looks wonderful. I learned a lot, so thank you.
Councillor Galloway.
Thank you, Madam Chair. First, I just want to thank the Crime Prevention Council, the Sexual Assault Center, and of course, Jam Drama and the Registry Theatre for really taking this topic on, and to Julie particularly from the Crime Prevention Council, who has kind of been coordinating the whole effort. It was a number of months ago that Christiane told me I had to go to a rehearsal for Chelsea's story, and so she took me by the hand, and it was quite evident at that time, I mean, for somebody like myself, who didn't really understand the issue, you start to understand it very quickly when you see the play. And so as Councillor, or as Chair Redmond said, I was able to attend. I took some friends. I took my daughter, who is a full-time guidance counselor, high school guidance counselor, who has has some experience dealing with some students who are vulnerable and have or could get involved in this kind of activity. And then also, I was happy to go to the KPL view, screening of the very young girls and the discussion that took place after that as well. And so I think there's been a lot of time and effort put into this from the various organizations, and it is somewhat frustrating that the rollout, I mean, there are various elements of the rollout that we've heard here today, and some of it is rolling out, but the actual presentation of the production in the schools, it may have been because of the sex ed curriculum being under review. It may be other things, and I'm just wondering, Madam Chair, if you might pen a letter to the two school board chairs or have some discussion with the two school board chairs to see if we can, as a council here and from your office, promote the notion of Chelsea Story being made available to a broader number of schools in the community. Where it was done in Cambridge, the results have been, or the impact, the commentary afterwards was very good and very positive. So there's no reason to believe that that would not be similarly received in many, many other schools in our community. And this is really where the impact of having Chelsea Story as an asset, it's a real asset to have that play in our possession, so to speak, or to have the rights to it in our local community, to be able to, let's just say, to use the same word, exploit that, that we have the opportunity to exploit having that asset and making good use of it. So I was wondering, Madam Chair, if that would be something you would undertake.
Yes. That's the answer.
Thank you.
Councillor McGarry.
Thank you very much, and through you, Madam Chair, I really appreciate the subject as a mayor of a municipality that straddles the 401. Since this emerging issue came into focus a few years ago, I can't go past the hotels along the 401 without thinking about this. As a matter of fact, I've got a council member right now that's looking at doing an event for awareness building in November. I've put her in touch with a well-known survivor in our area that does a lot of training for our police forces. You'll know the individual. And I've just connected the dots there. This would be another addition. And as you may know, Cambridge has just started its newest advisory committee to council on community well-being, and this would certainly fall within that scope. So I'd like to connect after, if that's all right, just to make sure that we're tied together there. I would really like to see this go further into the schools. I believe that the age group that you're targeting is the correct one. But I think in the work that I've done, either at a provincial level or in my conversations with some of the survivors and some of those that are actually providing services to victims of human trafficking, it seems to me that there's such little work that's been done on profiling the abuser. Why is it that we've got thousands and thousands of men right here in Waterloo region that continue to abuse young girls? That is the work that I think the province and many jurisdictions have not focused enough upon. If you cut off the demand, you're not going to have the victims to the same extent. So this is a direction that I would like to see further, and certainly open my community to the work that you're doing, and would really like to ensure that more people that see it, the better. Thank you.
Councillor Erb.
Thank you, Madam Chair, and thank you for your presentation. My wife and I attended Chelsea Story, and we left in a minor state of shock, looking at one another with teenage granddaughters, and just never realized the significance of this, and with a bit of embarrassment that wasn't forefront. Early that following week, I checked with the school where a couple of our granddaughters attend about the play coming there, and as I understood it, the issue at that particular point was the actors were volunteers and the schedules did not permit that to happen. So I commend you with the direction that you're taking it now. And this is just a unbelievable problem in our communities, and I wish you well in what you're trying to do to advance this. And it is it's such an easy presentation to take in, with nothing being offensive or worrying about people seeing it or hearing it or what they might perceive. So good luck, and I wish you all the luck in the world.
Councillor Kiefer.
Thank you, Madam Chair, and thank you for the presentation and the work you're doing. It's very important. My question is, or a suggestion maybe, if it hasn't been looked at, the theatrical play part is great, and I'm all for that, of course, but what about expanding it to video or social media of some sort? Has that been discussed or thought about?
Yeah, we actually have an archival video of it, which I wanted to mention. If any of you would like to review that archival video, we can make it available. But I've spoken with Sean McGrath, the playwright, about distributing the piece via video, and he's expressed some concerns because it's the main one. It doesn't have to do with intellectual property or the failed realization of monetary gain, more so with the absolute necessity of following it up with the talkback session. The play in and of itself is just the start. I mean, if you like, you're opening a bit of a wound, and to not dress and clean and care for that afterwards, you're only doing half the job. And the video doesn't allow us to ensure that there's going to be that talkback session.
Thank you.
I see no other questions. Thank you very much for the presentation and for your very informative answers. Our next item is another staff presentation, Less Telling, More Asking, Meaningful Youth Engagement at a Glance.
Madam Chair, this is Allison Pearson, who works with the Children and Youth Planning Table, and she's going to give us an overview of some feedback received from, or at least the research on feedback received from children and youth in some research that was done by the planning table.
Thank you. Good morning, Chair Clark and members of the Community Services Committee. If I haven't had the pleasure of meeting you in person, my name is Allison Pearson, and I'm the manager with the Children and Youth Planning Table. I'm very happy to be here today on behalf of the membership to tell you a bit about some work they've been engaged in terms of meaningful youth engagement, and specifically a resource that we've developed called Less Telling, More Asking. Before I get started, I'd love to just start with asking you a question. How many of you here have youth in your lives, young people, family, neighbors, friends? Great. I invite you, as I share with you today, to just keep them in mind as we talk about this. So first, if you're not as familiar with the Children Youth Planning Table, I'll start there. So the Children Youth Planning Table is a community planning table of just over 60 organizations in our community and other networks, collaboratives, councils that work with children, youth, and families every day. It's an open membership group of just over 600 participants at this point in time, and would include participants such as service providers, funders, researchers, municipalities, educators, for example. We all come together with the vision of working towards happy, healthy children and youth today and tomorrow. And the membership has established 6 shared goals, which brings them together in work. And that first shared goal is about children and youth feeling valued, heard, and included. When we say valued, heard, and included, that means things like there's an opportunity for voice to be heard, to participate meaningfully, and to contribute meaningfully. Yet youth in our community have shared that they don't always feel meaningfully engaged in decisions that affect their lives. And so for the membership, they really wanted to dive into this issue. They wanted to invest time and energy into building their capacity and skill in this area. And so we asked them, how would you like to do that? And they knew that some of the partners around the table are seeped in this world. They are very experienced with meaningfully engaging children and youth, and so they wanted to learn from their partners. They also wanted to learn from research, and most importantly, they wanted to learn from youth themselves. And so that's what we did. And we compiled all this learning in a resource called Less Telling, More Asking, and what that translates into is an 8-page document for those that are interested in taking in the information in that way. It's also been turned into a 7-part video series because we asked our membership, if you'd like to make use of this information, how can we best help you do that? And we heard a variety of formats was what would help best. So this series and resource covers such things as, what does it mean to have youth meaningfully engaged? What is adult allyship and what does that look like? What are some of those best practices that youth tell us when it comes to engaging them more meaningfully? And it's meant to be a starting point. It's that starting point to get that ground floor understanding of what is youth engagement and adult allyship. Online, we ran this video series over the summer weekly, and we've had close to about 600 collective views on the video. And I brought a sample today so that you could have a chance to see it and get a sense of what I'm referring to.
Why is youth engagement so important? To begin, the youth brain is in an amazing stage of development where it has a heightened potential to change. This is called neuroplasticity. Experiences through meaningful engagement can then open up opportunities for tremendous growth and adaptability in a young person. At the same time, by age 15, a person's reasoning ability, or their logical thinking and problem-solving skills, is fully developed. This means that youth have insurmountable potential to contribute, which can be realized through opportunities for meaningful participation. In recognizing youth's ability to be agents of change in the community, there is a valuable opportunity to connect youth with those who hold decision-making power. When we do this, communities can better leverage innovative solutions. So let's take a look at what happens when youth are meaningfully engaged. Both youth and adults develop new skills and build their capacities as agents for change. Organizations and programs are more responsive to youth needs and wants. Networks are strengthened between youth and adults, and an increased sense of belonging for all ages in the community is fostered. Communities pave the way for innovative solutions to societal challenges. All in all, youth have something to contribute now, and this means changing the mindset from how can adults help youth to how can youth and adults help each other.
So hopefully that gives you a little taste of what those videos include. So what's next? So next for us is going back to the youth and asking them, what do they think of a resource like this? So they're the ones that helped inform this, and we'd like to know, knowing that these are professionals that work at organizations that they and their families might engage with, what do they think about a resource like this out in the community, helping to inform and build capacity in the system? We're also asking adults the same thing, and it'll be interesting as we capture this on video to see the similarities and differences between how youth respond to a resource like this and how the adults do. We're going to bring that reaction video to our next all-member meeting on September 26th, and as a full group, reflect on that and think about how it informs our final piece, which is a discussion guide that will inform or be a complement to this resource for organizations and professionals as they seek to have different conversation in their organization about their current practices around youth engagement and where they might like to go in the future. So I thank you very much for being here today. I invite you again to think about the youth in your life and the opportunities that you might have to engage in some different questions and conversations with them. Happy to take any questions.
I see no questions. Thanks, Allison, and that was a great little video. Thank you.
Thank you.
All right, item 5.4, it does not have a presentation. But it does have recommendation, the elimination of the transition child benefit. Would anybody like to move that recommendation? Councillor Erb, seconded by Councillor Novak. I see no questions. All in favor? That's approved. Item 5.5, similarly, no presentation, but recommendations. This is the Community Capacity and Innovation Funding Plan. Moved by, Councillor Kiefer and seconded by Councillor Lorentz. Any questions? Seeing none, all in favor? And that's passed. There's no information or correspondence. There's one item on the council inquiries list with an expected October response. And we do have one other business item. We have a quick update from Public Health on our CTS site, which Dr. Wang is going to deliver.
Thank you, Chair Clark. So I just wanted to provide a brief update in regards to the interim consumption and treatment services site. We are happy to report that we expect we'll be able to begin operations in approximately 4 weeks. So the lease has been finalized and work to renovate the space is already underway. We expect the renovation work to take approximately 4 weeks. Within the next 2 weeks, we will be in a position to confirm dates for the opening of the interim services, and council will be advised of relevant dates. Thank you.
That is such good news. We do have a question from Chair Redmond.
Thank you, Chair Clark. And I was just going to add my congratulations to you and your team, Dr. Wang. This has been heavy slogging. Everything's taken longer than we anticipated, so well done.
Thank you very much for council's support.
And I think I'll just add in anticipation of the question that we are still waiting for word from the province on the funding of the permanent site.
That's correct.
But communications are happening on a regular basis.
Yes, they continue to actively review this file.
Thanks very much. All right, our next meeting is Tuesday, October 1st. Do I have a motion to adjourn? Councillor Armstrong, seconded by Councillor Foxton, and I don't know if I need all in favor, but we're all in favor anyway. Thank you.